Now students, we will discuss that what is therapeutic index, what is therapeutic ratio, and what is standard safety margin. Now, firstly moving towards the therapeutic index. The therapeutic index is the ratio of TD50 to ED50, where TD50 is the drug dose that produces toxic effect in 50% or half of the population, and ED50 is the drug dose that produces therapeutic or desired effect in half of the population. So, this ED value actually gives us estimate of the potencies. For example, if we have two drugs, first one produces a therapeutic effect at 5 milligram and other is producing the quantal effect or the therapeutic effect at 500 milligram. So that in this case, the drug which is produces effect at 500 milligram or the 5 milligram will give us estimate of the potencies. For example, in this case, the drug which is producing the quantal effect at 5 milligram is said to be 100 times more potent than the second drug that is producing the quantal effect at 500 milligrams. Now, this quantum dose response curve gives us estimate of the margin of safety, which we will discuss in this video. So the therapeutic index is the measure of drug safety. If we have larger therapeutic index, it means our drug is more safe. So wider margin means large therapeutic index means there is wide margin between the dose that is producing an effective response and that is producing a toxic response. So this is the curve which is representing the therapeutic effect, and this curve is representing the toxic effect, that is the death. So this is the graph between the population, percent individuals responding, and this is the dose which is representing over the y-axis. Now, here in this case, in this figure, in this graph, these shaded boxes or these bell-shaped curves are actually indicating the frequency distribution of the dose of the drug that is required to produce a specific effect in the population or in the animals. And this curve or these open boxes or these colored curves are actually representing the response. This is a therapeutic response. This is the toxic response. Now, how to determine the therapeutic index? We have already discussed the formula, that is the ratio between the TD50 and the ED50. So in humans, this therapeutic index gives us estimate about the safety of the drug. It gives us estimate about the effectiveness of the drug. It gives us estimate about the standard safety margin. So if we have patient in critical situation or in critical disease, in this case, we may use the drugs with narrow therapeutic index. For example, in case of the Hodgkin lymphoma, we use certain drugs which have narrow therapeutic index, in which the difference between the therapeutic and toxic doses are small. But for certain conditions like for headache or the diseases which are not threatening, in these cases, we prefer drugs which have wider therapeutic index. So drugs with narrow therapeutic index are also routinely used. For example, we have discussed Hodgkin lymphoma, but for simple conditions, for simple diseases like for the headache, the drugs with narrow therapeutic index are not acceptable. So here we have examples of warfarin, which is an anticoagulant, and penicillin, which is an antimicrobial agent. Warfarin has narrow therapeutic index and penicillin has large therapeutic index. So now we are going to discuss warfarin. So as the dose of the warfarin increase, the greater fraction of the patient will definitely respond. So in the case of the warfarin, we consider for that this drug, the desired response is 2 to 3-fold increase in the INR, where INR is the international normalized ratio. And this is the ratio between the patient's prothrombin time to the normal mean prothrombin time. And what is prothrombin time? Is a blood test that measures how long it takes for the blood to clot. Okay, when we are discussing about higher INR or when we are talking about 2 to 3-fold increase in INR, it means we are talking about that. This means that the blood coagulates too slowly. So the desired effect for the warfarin in these cases will be 2 to 3-fold increase in INR. And warfarin is a drug which has a narrow therapeutic index. This figure is representing warfarin. This is representing graph between the population and the drug concentration. This green curve is representing desired therapeutic effect, and this red line is representing the unwanted effect. Here this 50 is representing effect in 50% of the population. And here there is an other term that is therapeutic window, which we will discuss in this video. So in the case of, as we know that this warfarin has narrow therapeutic index. So there is possibility that in certain conditions, in certain patients, the increase in dose may result in hemorrhage. So what happens that if we have warfarin and we know that warfarin has low therapeutic index. So in some cases, the effective dose and toxic doses are overlapping. So in some patient, there may be hemorrhage, whereas in other cases, there will be 2 to 3-fold increase in INR, that is the desired effect. So the patient response will definitely affect the drug activity or the drug effectiveness. Now moving towards the penicillin, this is penicillin, this is the graph of penicillin similar to that of the warfarin, but in this case, there is not overlapping, there is not much overlapping of the therapeutic effect and the harmful effect. This is representing a wide therapeutic window as well. We will discuss this term therapeutic window in this video lecture. So warfarin is a much safer drug because it has a wide therapeutic index. So these were the graphs which we discussed regarding the therapeutic index. This is of warfarin that has the narrow therapeutic index, and this graph is of penicillin which has large therapeutic index. This graph is also representing that warfarin has wide narrow therapeutic window while penicillin has wide therapeutic window. So in both cases, in case of both quantal dose responses and the graded dose responses, we get sigmoid graphs. Now, in both cases, we can get estimate of the potencies, we can get estimate of the drug safety, particularly in the quantum dose response relationships. So, another indication and other feature which we can get or extract from the quantum dose response relationship is the certain safety factor or standard safety margin. So, what is the margin of the safety? It is the ratio of the LD1 to the ED99. So it is the ratio of the dose that is lethal in 1% of the population to the dose that produce therapeutic effect in 99% of the population. Now, what is the therapeutic ratio? Therapeutic ratio is the ratio between the LD25 to ED75. That is, it is the ratio between the median lethal dose that is producing lethal effect in 25% of the population to the median effective dose that is producing effective response in 75% of the population. So this was all about the therapeutic index, therapeutic ratio, and the standard safety margin. Now, in our next video, we will discuss about the therapeutic window, which give us much better estimate of the safety of the drug. There we have discussed the difference between the therapeutic index, therapeutic ratio, and the standard safety margin.